Welcome to the Long-Term Care Chronicles podcast.
To go. So thank you so much again, Councillor Matlow, for joining us today here on the Long-Term Care Chronicles.
My pleasure.
Perfect. So we'll start off, I guess, with the in long-term care with the COVID-19, how this really impacted, I guess, all 10 city homes, and how, I guess, the city, realized in terms of how to be able to handle this type of particular situation.
Yeah, I've had a number of discussions with our city officials who either work directly or oversee our long-term care homes, and it's clear to me that I think initially during the pandemic, and understandably given that it was a novel virus, that there was a lot of learning to do. There are many intuitive things that were done that I think made our publicly funded and publicly operated homes far more resilient than many others in the private sector. But there were, many lessons learned. Our city had to quickly adapt to, increasing screening and improving the quality of screening, and ensuring that, for example, that along with the provincial directions, that even the people who work in our homes were the very reason why the virus was being transmitted to others. There were a lot of lessons learned, and worries initially around access to PPE and other concerns that had to be addressed. But what I'm confident about is that while there have been some tragedies, I think Seven Oaks is an example of just a devastating example of where things can go very wrong very quickly and spread like wildfire. It's clear to me that the supports that the city has for its workers and its, along with its PSWs, for example, made a big difference as far as just, their jobs were less precarious. There was more support just built into the infrastructure of how we do our work than many long-term care homes across the province that are run by the private sector that were run with more of a profit motive. And it's just evidence to me that there are a lot of lessons we need to learn, but there are also a lot of lessons that we can share. I saw in Kingston, for example, how right off the mark, their city reallocated, redeployed a lot of their bylaw enforcement that would typically visit restaurants immediately towards the long-term care homes in their city to be able to ensure that there was proper screening and support. I also strongly believe that the relationship between our homes along with other long-term care homes in the non-for-profit and private sectors need more formal and close relationships with acute care or hospitals, so that when we are able to address our care needs, our residents' needs, our staff's needs, and HR when people are legitimately scared to go to work, that we have the support immediately of hospitals who can provide us the support that is needed immediately, and have the people who can come in and support us too. And that relationship shouldn't just be an emergency measure. That should be a continuing relationship. The other thing I should add is, and this is an ask that I'm making to the province, that while we now build from what we've learned, and we make our homes the safest and most secure homes possible, that we don't just build a bunch of Fort Knoxes, that we just don't build these fortresses that forget about the quality of care that we want to improve on even in normal times, never mind during pandemics, where the people who live there are not isolated and lonely, and that the quality of the living environment can continue to increase in standards that follow the emotion-centered approach. And these are some of the asks that I'm making to the province, but also emotions that I've made to the city itself to improve upon.
So then you would say, I guess, going forward, to make sure that you do have the testing in place, those type of protocols, the PPE, And as well, I know that you last year it was your emotion-based centered approach to. Is that going to be now fast-tracked, or is still going on the same schedule to launch that out to all homes? So that type of approach can be to accommodate, I guess, with especially the isolation, the loneliness that a lot of the residents probably faced.
Yeah, I mean, ultimately, I want to see every recommendation that we have and everything we know to be quickly adopted, and changes need to be made in real time, because we are still in a pandemic, and there may very well be a second wave. So, as I keep reminding people, we may be done with the pandemic, but it's not done with us. So we need to be making decisions in real time to continue to learn, continue to adapt and change and improve. We also need a long-term inquiry to make sure that we understand what mistakes were made, own them, accept them, not with a punitive or partisan approach, but just to learn and grow and improve so that we are better prepared, not just in a few years, but even this winter. Exactly. And then moreover, and by the way, even to that inquiry, we should be adopting lessons as we learn that they have conclusion of it. And then, moreover, yes, I moved a motion, as you know, to bring an emotion-centered approach to care in the city, in the city's homes. The city agreed to pilot it, and that's what they agreed to, and that's what's budgeted, and that's what's been approved. I'm not an incrementalist by nature. I also recognize that you sort of have to prove that you're right before just demanding that you are. And so I don't see that expedited. That being said, though, I'm also making requests to the province, beyond and above what we're doing at the city, to take an emotion-centered approach and actually make it part of the provincial standards, which considers just the approach to people with dementia and others who are living in their homes to be more caring and provide more individualized care rather than treating them like patients, to involve them in their own care and understanding who they are and what they need. But to be able to do that, we also need to allow our PSWs and other staff the time and the ability to do their jobs as well as they want to and know how to do. If we have PSWs who are overworked, overpressured, stressed, having to hold down 2 other jobs, and aren't paid well, and don't have benefits, in the way that I think we do a better job in the public sector than the private sector. No argument. But if we don't support them and allow them the hours that they need to be able to not rush from resident to resident, but really be able to build those relationships so that they can then get to know who they are and what they need, then we're not going to do a good job. So a lot of this has to do with not just talking about our PSWs and our frontline workers as heroes and put fly those flags and put beautiful pictures in our windows and, knock our pots and pans during emergency times, but remember them after the emergency. And don't forget that, we need them not just during emergencies, but they're caring about the people we love every single day, all year round, pandemic or no pandemic, and as the years move forward.
Yeah, so, because with the this pandemic, the COVID-19, it's obviously going to be around with us for some time, for the foreseeable future. And with family caregivers, how can they be included in this type of dialogue with the city, that they have their family members in these facilities, to be able to be part of, I guess, at the table, to give their voice as well, to say, how can we be able to see our loved ones, still keep in contact? Because I know with some of the communication piece, a lot of the homes didn't have, let's say, the technology to be able to facilitate a lot of that. So how can that, be enabled moving forward to be able to try? You
bring up such a good point, and it was not lost on me that while the province was boasting about providing tablets to students, the very people who were the most vulnerable in our long-term care homes, the reason they were the most vulnerable, along with shelters, is because this virus goes after certain groups more than others we've worked. Those who are over 70 and those who have pre-existing conditions and most certainly in congregate settings. You're going to find all of that in many long-term care homes. So that's why our attention needs to be focused on our long-term care homes. And there was not and has not yet been a good enough effort to ensure that there is Wi-Fi along with the technology itself, tablets, to be able to ensure that whether it be the resident at that home or a caregiver working in that home, like a PSW or something else, to be able to manage that for them, but to be able to talk to their grandkids or talk to their family. COVID-19 is a disease that's killing people, and we're rightfully obsessed with it because it's affecting our lives and taking lives and destroying our economy and our normality. That being said, though, it is not the only thing that hurts us, and study after study demonstrates that, and certainly in the seniors, isolation and loneliness, but it affects us all in this way, also has a direct impact on our health, our longevity, and our quality of life. So COVID-19 is something that we need to be on guard for, but loneliness and isolation is too. So I've written to the province. I'm asking people to support that ask. If people will, if they believe in that, go to my website at joshmatlow.ca,
Okay.
and you will see my asks on behalf of those who I hear from who share these values to the Premier, to the government, to make these changes. And again, this is not punitive, and this is not partisan. You don't have to be a Liberal MVP or Green, and also you don't have to feel on the defense if you're a Conservative. It's not about that.
Yeah.
This is the Premier we have, this is the government we have, and they have an opportunity to do amazing things. And we want to encourage them to do that things based on the feedback and understanding of those who work, live, and care about the people who are in our long-term care homes. The other thing, by the way, I should bring up is that I co-chair an accountability table with Dr. Samir Sinha, who is rightfully celebrated head of gerontology at Mount Sinai and just an incredible person. And we bring together between 70 and 90 voices from the non-for-profit sector, everyone from community organizations, caregiver organizations, and government, and first responders, etc. And we all come together on a regular basis to not just figuratively bring all those voices to the table, but literally create a table, although these days it's virtual, understandably, as this has to be, but to ensure that those voices are heard. But for the average resident, go to my website and I spelled out how you can, make your voice heard, and that would be incredibly helpful.
Absolutely. We'll definitely put that out there as well. So basically what you're saying is, I guess, in your steps moving forward, you are having dialogue with the province. You're having dialogue with the greater community as well to say
Yes.
what will be the next steps or how we can be able to better support during this time of, during this pandemic, right? So
even when I had to go into early isolation, self-isolation, early March, I was on the phone from morning till midnight, literally, with so many people who were going through various degrees of struggle through as society started going sideways. And I heard a lot from people who were concerned about our long-term care homes, the ability that we had at that time to protect the people who both work and live there in our homes, and we're raising really important points and ringing alarm bells at times where I think we could have done better, sometimes because we should have known, and sometimes because we couldn't have known, and now in retrospect we need a reckoning about what happened so that we can improve upon it. But all those voices are important. I am constantly trying to learn from people who are living this every day so that I can amplify those voices and advocate for them. And for example, when you go to my website and you sign on the petition and you make your voice heard, it doesn't just go to it's not just something you sign. There's a mechanism that actually allows it to go to your local MPP, for example, along with the government directly, so that these messages can make an impact, and then we can actually see some real change made. But it takes a few minutes to just go and do something like that, and rather than just complain, we have to push for change. And through the accountability table, we actually set up a mechanism even within local government for people to literally hold our feet to the fire so that when we create policy, there's a check-in before it's implemented. And I think it's really important.
That's great to hear. And so what will be then the checks and balances then moving forward for these changes that will be coming up within the city-run homes?
So within the city-run homes, we are both asking for the city to be a productive and transparent partner in the province's review. I would prefer it to be a full inquiry because that has more depth and tools to be able to seek the truth and more transparency and accountability. But even if they stick to their position that it's going to be a commission, then I want us to put up our hand and say, we are going to be the model for other sectors to look at, and I say sectors in not-for-profit and private, to resemble. In other words, our willingness to not hide, to put everything on the table, to share what we've done well, admit what we've done wrong, and grow and learn and contribute to accountability and safety, most important. Moreover, Paul Raftis, General Manager of our long-term care homes and senior services, has committed to also an internal review of Toronto's homes. That review, and I know the mayor because I've spoken with him about this, can't just be something that is sort of like slipped over to council or the mayor and signed off on and say thank you. There needs to be openness about the results of that review, and there needs to be public discussion so that we can be pressured to do better and more as well. But again, I mean, what is clear to me is that we have to, keep improving on our city's long-term care homes. In a position that you are in and I'm in, where we care so deeply about what we do with the city, we need to keep putting the pressure on the city to not pretend that we've figured everything out and keep improving and building. But I also am convinced, just based on what we've seen through this pandemic, that even as imperfect as our long-term care homes are, and the tragedies we've seen at places like Seven Oaks, our homes are more resilient than the ones that are run privately, and we need a reckoning, and we need to ask why that is. And we need changes to ensure that never again do we see the horror stories that came out of the Armed Forces report, where, to say it simply, I think anybody who wants to be able to remain at home to the end of their life should have that opportunity. And home care needs to be strengthened and improved. And I also believe that for those who are going to, for whatever reasons, and there are many reasons, or even prefer to be in a long-term care home, they need to be places where each of us would feel not only comfortable, but happy to have anyone we love live there, or be there ourselves. And certainly that goes for the people who work there.
Absolutely. So I guess in terms of, as I said, with family members, I know protocols will probably have to be in place for them to visit, whether that's outdoor visits, and even if there is the opportunity to be able to have indoor visits, how would that look, right? So I guess part of the inquiry will touch upon some of these items. Is that correct?
Well, it'll be both the inquiry, but also, most importantly now, based on the real-time advice of our public health officials. We've learned a lot about this novel virus, but we're still learning.
Yeah.
And what we understand today that we didn't know in March, for example, is that we are more vulnerable to both transmitting and contracting the virus and having the disease in indoor spaces and in congregate settings. We are less likely, although not immune, to doing so in outdoor spaces. So as the province is allowing, finally, and I've been asking for this for weeks now, for an essential, loved one to help contribute to defeating, loneliness and isolation in their homes. I think it's reasonable, and especially we are in warmer months, and it's practical in Canada to do this right now, to have outdoor settings where we meet. The question will be in the fall, and as the weather changes, have we determined if it's safe or not? Not just to those individuals who are meeting, but collectively to everybody else in the home to let somebody be in that way. And right now, I think out of an abundance of caution, it's too early to go there. But of course, if it's deemed to be safe, then that should be considered. But phased, right? Phased. And we all have to be ready, whether you're in a long-term care home or anywhere else in society, to accept that if we find that the cases are going up or the deaths are going up, and the next wave is harder than we would want, then we also have to be prepared to go back a few steps if necessary.
No, that's great. And of course, with the city, you're working with the public health as well, with a lot of those protocols to have in place. And I guess because most of the city homes were, except for a few, were impacted negatively. But for the ones that were, doing quite well, I guess those ones where you'll take the lessons learned, I take it, from those particular facilities that are within the city.
Absolutely. I think we need to equally learn about what went wrong at Seven Oaks, as we can learn from how, at least I've observed, we'll know more, I've observed Witchwood Towers, Castle View Witchwood Towers, address their outbreak. And there are many other examples where I think we need to review, and this is happening, it will happen, again, just honestly and in a transparent way, what could we have done? Like, I'm convinced already that there, and again, this is my opinion, but just from everything I've learned, intuitively there could have been a better job screening from early on. Just even out of an abundance of caution. Because if it's a novel virus, and we can admit that we don't know enough about it, why wouldn't you want to tighten up even a little tighter at the beginning, and then learn that you can loosen, rather than perhaps not collecting information that they eventually did with improved screening that it eventually evolved into. But again, it's easy to sort of look back and go, they should have, could have, would have. That reckoning will happen, that review will happen. It's got to be transparent. It's got to be done in a way that it arrives at a committee at City Hall where it's open, and members of the public, including those of you who, work right there, can ask questions without fear of repercussion. Because, just like my dad used to say to me when I was a kid, that people don't fix things until they accept the blame. And it's not about being punitive. It's not about looking for who to blame. And maybe there should be blame if somebody did something deliberately wrong. That's a different story. But our whole focus really should be, how do we make our long-term care homes the safest, the most resilient they can be, but without forgetting to make them wonderful places to live and work, and places where people get the individualized care that addresses who they are and how they need to be cared for as people, rather than just patients, and not turn these into clinical penitentiaries where people are isolated. And if we can do all of that, then we've, I would submit, done something that should have been done regardless of it. And that's another question that I think we need to ask ourselves. Why wasn't elder abuse in some cases? Why wasn't the way we pay and care about the people who work in our homes considered more? And why weren't those individuals who live there considered in a different way, in a more caring way? City, not-for-profit, private, to different degrees.
Yes. Yeah.
But why why has it taken so many different efforts to even get motions like mine passed, to even do something incremental for a pilot? Why is that so radical and remarkable? Why isn't it just something that we want to do and are willing to invest in? And why wouldn't that be a reflection of our priorities? I think these are questions that we need to ask. And I'm glad that we're finally asking.
No, look, this is a great opportunity, and I'm glad for this type of conversation to be had. I think it was needed well before the pandemic, but I'm glad that the city is moving forward with a lot of these initiatives and trying to find some way to be able to work within this particular COVID-19 pandemic to be more, I guess, aware and more encompassing of the residents that they take care of. So
I appreciate that, and I want to reiterate that both Paul Raftis and Mayor Tory, I've spoken with both of them, and they not only have made commitments, I believe that they are genuinely dedicated to the same goals, and that gives me confidence. That excites me because I'm not seeing anybody block. I'm seeing everybody sort of say, yes, of course we need to make these improvements. And we need to be open and transparent about it. And that gives me some hope that we will move in the right direction. I just always want it to move faster than
absolutely.
Let's keep pushing.
Well, thank you so much, Councillor Matlow. I really appreciate your time and for you to speak
My pleasure.
on this. So, again, thank you so much.